Challenging time for all of us, but now's the time for working together. It's a time for compassion.
A time for compassion as COVID-19 continues to spread in British Columbia. The province is home to 72 cases, including Canada's first COVID-19 related death. A man in his 80s died this week, infected at his North Vancouver care home. Since the outbreak started, BC's provincial health officer has been there every step of the way. For some, her daily briefings are must-see TV. There's even a fan club. So how did one woman become the face of pandemic PR? BC Provincial Health Officer Dr. Bonnie Henry is used to being on the front lines of a pandemic. She's faced down SARS, polio, and even Ebola. She's been doing daily press briefings. But this one, after the virus hit a local care home, went viral.
I am asking people to consider having virtual gatherings, to consider not coming together, particularly if you have people in your gathering who are elderly, who are more
Henry choked up, later saying it was partly her thinking about how her parents must be worrying about her. She's also popular for lighter moments like this, her hand-washing advice.
Wash your hands like you've been chopping jalapenos and you need to change your contacts.
But the job takes a toll. Here's what Henry told TVO about dealing with COVID-19. Since this started, all my SARS post-traumatic stress has come out. That compassion has led to a fan club. One even created a Twitter page that now has more than 2,000 followers. One posted, "You are a caring medical professional with skills based on science who puts healthcare first and avoids the politicizing of the events by politicians and businesses." Across the border, it's a different story. U.S. President Donald Trump is the one getting all the attention for how he informs people about COVID-19. Earlier this week, he played down the severity of the outbreak.
It will go away, just stay calm. It will go away.
But then the next day, Trump banned travel to European countries, and that flip-flop is causing confusion. In Canada, much of the focus is on what the experts are saying. Public health officers like Dr. Bonnie Henry have become reluctant heroes in Canada's fight against the virus. Maureen Taylor is here in studio. She was the chief medical correspondent for CBC during the SARS outbreak. She's now a physician assistant in infectious diseases. And Taylor was married to the late Don Lowe, the senior microbiologist, one of two spokespeople for SARS in Toronto. So Maureen, so close to this, still so close to this virus. Well, what do you think? I mean, we're hearing so many of the public health officers are going to be giving daily briefings. We had a whole raft of senior ministers, bankers, in Ottawa on Friday. What do you think of the public messaging?
Well, here's my problem with what the public health officials have been saying up until now. They have been telling us every day, the risk to Canadians remains low. And I think that while that's true, that has changed substantially. And we knew it was going to for the last at least 3 weeks. And what they should have done, in my opinion, is start to prepare us for what we've seen happen recently. Start to tell us what our world is going to look like as we move from a strategy of containment to mitigation. Get to understand that schools might be closed. Understand that you may be restricted and even going on your March break trip. I think that all of this came as quite a shock to people, and it didn't need to.
So we weren't prepared properly.
That's what I have to conclude. The public messaging didn't work. But you know what I want to see in the future? This virus is going to move, as you know, across the country. All of our provincial medical officers of health, as well as our federal experts, need to get together and have a consistent approach to social distancing, consistent approach to travel advisories. I'm confused about who's doing what. And so that's what I hope to see in public health communication messaging going forward.
It's quite a hard job to carry this burden, to be a public health officer, as a reporter, as someone so close to someone who was doing this.
Yes.
I mean, we've heard Bonnie Henry say that she suffered from PTSD after SARS. Now she's got a fan club. There's lots of love, but it's also hard.
What's great about her and what was great about Sheila and Dawn is that they didn't have huge egos and they were transparent. But it has to be hard. They have to not only worry about all the contact tracing that must be going on behind the scenes, but also how much do I tell people? How do I not instill panic, but still be transparent? But I do think that they've done a good job. I think they could have done a better job had they moved from containment to mitigation and made that clear to us a few weeks ago.
A very different approach here compared to what Donald Trump is doing in the United States, where he's sending out, some would say, conflicting messages. Here it seems to be the approach is to let the scientists speak, although we're hearing from politicians as well.
I love when I see the politicians stand in the background and say nothing. I think that's what I see. Bonnie Henry gets to talk, and that guy beside her, I assume he's the Minister of Health. He like, stand there, look pretty. If you have money to announce, we'd love to hear about that. That should be their job. Let the public health experts and the microbiologists and infectious disease experts talk to people about this virus. Politicians and what Donald Trump is doing is only making people more worried.
But I wonder, is it fair? Because you could say that that if the scientists are right and can stop the spread, then they get all the credit. But if it continues to spread, if it gets worse, then the responsibility is on them and not on the politicians.
You know, looking back at SARS, not too many people pointed fingers at the governments themselves and what they did. You know, no one said they didn't provide us with resources. No one said that they dropped the ball. Everybody shared some blame for some things that went wrong in Toronto. So certainly I hope they didn't get into politics to take the credit if we get this virus under control. I really do think so far in Canada the politicians have been taking the right approach.
Maureen Taylor, great to talk to you. Thanks so much.
Thank you.